Well, if the basis is trying to reduce your reliance on glasses during the day, and obviously, LASIK, it's a more permanent kind of change. The principles of how you reduce someone's myopic correction so that they can go about the day with seeing clearly in the distance without the use of glasses work on pretty much the same principle. And we like to bring out the old model, and we'll do that. And so effectively, the cornea is a very, very powerful lens. It does most of the bending of the light so that it reaches the back of the eye. And so you only require small changes in the curvature here in order to restore focus at the back of the eye here. So laser does it by surgically flattening the eye, and Ortho-K does it through a different means, using a contact lens and using the natural elastic nature of the cornea. And the cornea is basically just a fancy bit of skin. And so you end up basically doing the same thing, flattening the central part of the cornea, which changes the focus at the back of the eye. It's just that the actual method of doing it obviously is different.
So, perhaps there are some risks or some side effects that come along with LASIK that you don't experience if you do choose Ortho-K. Is that a correct statement?
Yeah, look, any surgery has its risks, and if we're going to be fair, any contact lens wear, and Ortho-K is a special type of contact lens. You've got to be mindful around infection risk. So you've got to compare those kind of two things. A lot of the time, infection risk is a lot of it's in your own hands at doing all the right things. Surgical risk is a little less in your control. It's in the control of the environment that you're having the surgery done and the surgeon. There are, from my observation, some challenges with the higher prescriptions in laser surgery. That's typically where I might see some of the progression, and the research seems to support that once you get up into very high degrees of myopia, then the laser surgery, you can get progression. And equally, you've got to be an experienced Ortho-K practitioner to be able to fit high degrees of myopia. We can certainly do it. It's probably not as routine as some of the lower amounts. As far as the comparisons go, people are often getting Ortho-Ks, they might experience dry eye with regular daytime contact lenses. And so we're providing the benefit of restoring their sight without glasses and avoiding the issue of increasing dry eye symptoms at the same time.
And I think it's probably not a huge risk factor, but I understand that with traditional LASIK, at least, if let's say, you're somebody who does martial arts or combat sports or something like that, there is a risk of what they call flap dislocation with the LASIK, which of course is not an issue if you're using Ortho-K.
That's right. I mean, you get a finger in the eye, and which can happen easily in martial arts, then that is one of the risk factors. And obviously, look, you can still get a finger around the eye regardless of wearing glasses, contact lenses, or Ortho-K, but you've got a much more tightly stitched together cornea. We're not actually disrupting the sort of structure of the cornea. We're kind of just taking advantage of the elastic nature of that specialized piece of skin.